There she is in front of, I think it was the Supreme Court at that time, talking about rational responses to the COVID-19 so-called pandemic. Dr. Gold, welcome to the program.
Thank you so much, Dr. Drew.
So I've got a million questions, and I'm excited to talk to you. I think let's start with the book, and maybe define what your goals were in that book and what you mean by American fascism. And let me tell you why I'm asking it that way. Because one of the most astonishing features of this pandemic was that the whole world followed our ridiculousness, the whole world. And maybe not Africa, where they got it right and things were much, much better there. But essentially the Western world followed what we did. So have at it.
Yes, so I think I saw it a little bit earlier than my physician peers because I was open-minded to it and also because of my legal training. And the reason I titled my book Selective Persecution, which is a play on prosecution based on my ER training, the legalization of American fascism, is people have to know that fascism doesn't look the same everywhere you are. From the citizen's perspective, it is very tyrannical. It's almost enslavement no matter where you are, but it's a little bit different. It's not going to look like it does in China or in the USSR. It's sort of an American flavor to the fascism, to the tyranny. So this happens to be my personal story of everything I went through from being a COVID policy whistleblower and watching the alarming infringement of our constitutional freedoms based on ridiculous public health policies, absolutely absurd and illegal, to becoming targeted by the government in J6 in my imprisonment. And I saw how illegal the FBI was acting, how illegal the DOJ was acting, how the judges had did things that were so inconsistent with proper judicial temperament. So every chapter walks people through what I directly experienced. There's a lot of receipts in the book. There's tons of references. It's very well, I don't want anyone to say that, I'm taking any liberties with the truth. I give specific examples why I'm pretty alarmed at the infrastructure of tyranny that we really do have in our nation. And thank God we have a change in administration, but that infrastructure for tyranny is still there. When you read how the FBI came and, broke down my door, and you read how I was sent to a maximum security prison, these things couldn't have happened if we didn't have, really an infrastructure for tyranny that's already here. So it's very eye-opening, but it reads rather like a John Grisham novel, quite frankly. You can't believe it's real.
So you need to make it into a movie so people, or a documentary, or both. I'm guessing that's coming.
I think, a lot of people think it should be a movie. It's kind of an Aaron Brockovich, David Goliath thing. I went up against the federal government after me hard. I was attacked by the California Medical Board. I was attacked by the New York Bar. I was attacked by Congress. And a very interesting chapter relates how the federal government tried to plant narcotics on me, which would have been the best way to take me down. And I have all the receipts. It's quite something.
And so what are your remedies for all this? And so you have your personal remedies, and then what do we as a citizenship need to do?
I wrote the book so that people can be armed with information. I don't want people to be depressed. We don't yet live in China. Like, there are resources, and one of them is just starting with being awake to the situations around us. One of my pleas in the book is that the ordinary American citizen doesn't comply with things when they seem bizarre. It's heart-wrenching that the FBI officers who were breaking down my door, once they got there, they clearly realized this was over the top, right? So I want an officer who finds himself in that situation to pause and to say, is this right? Like, I want people to think in the moment. This was on the heels of my noticing during COVID that doctors and nurses were not doing the right thing. They were just following orders. And so part of this is just kind of a wake-up call so that you in your own life, no matter what job you have or neighborhood you live in, when you see a tyrannical kind of infrastructure taking hold, is to push back on that. So we do have recourses.
Yeah, I mean, it seems easy to say that. I mean, by the time everyone was caught up in a hysteria, though, the populace played the role of enforcer, much the way they did in 1939 in Germany. And so that's the part that's really scary.
We're on the same page. I talk about that a lot. I'm very sensitive to it. My father was a Holocaust survivor, so I grew up knowing these stories, how quickly a society can absolutely turn against a disfavored minority group, in this case, political conservatives. I'm well aware of that. There's a lot of practical advice in the book. One of the things I want to share with people is this fear that humans have of being, having a reputation damaged. It's intrinsic really to the survival of the human species. I understand it. But it's next level in our time. It's instant worldwide communication that can bring down a person's reputation. We call it cancel culture. And it is very, very strong. But I'm telling you that there are worse things than having your reputation smeared. You have to do what you know is right in your soul, or else you start self-censoring yourself and your soul starts dying. And more profound people than myself have said it more eloquently, but that's my advice to you. We live in a time of cancel culture, but it's not the worst thing in the world to look that beast in the eye and still do what you know is right.
Well, it's hard to keep your compass due north when all the craziness is around. I knew immediately something was wrong, but I missed the amount of infectivity. I missed how sort of brutal COVID was going to be in certain populations. It was brutal. It was a tough illness. But I knew that the reaction was wrong. I knew that the risk reward was not being contemplated by anybody.
There were specific things I knew as a physician that became clear early that were a lie. For example, if the power brokers had simply said hydroxychloroquine didn't work for SARS-2, I might have gone more along. But instead they said it wasn't safe. Now, this was a drug at the time was FDA for 65 years, right? And then they mocked ivermectin when it literally won the Nobel Prize for medicine. So they went too far with their lies. And when you see that in your own life, when you see people saying things that you know are false, you please do not self-censor. That's really what drove this, was a lot of people fear over cancel culture.
Yeah. So when that was all going on, I do this, internal medicine, we have this thing called the MKSAP, which is sort of a board review. It's a very comprehensive board review. We do I don't know if ER has something like that. Oh, why do you put Gell-Mann amnesia up? I guess that's part of...
She was literally just referring to Gell-Mann amnesia, which a lot of people experience.
You know well. Yeah. It's you think you are wrong, even though you know when the press writes about something that you know well, they are always wrong. Guess what? They're always wrong, period. But what was I just talking about? Damn it.
The MSKP, whatever book.
Oh, the MKSAP. Thank you. And just for your future edification, when you bring this particular topic up, hydroxychloroquine and canceling people who want to use a simple medication that's over the counter most of the world, is that in the MKSAP, in the rheumatology section, in 2019, I was doing it and I was like, oh, look at this. There was a question about maintaining your lupus patients on hydroxychloroquine during pregnancy. And yes, you are supposed to continue I don't know of any medication, including Tylenol, that's recommended like purely. It's recommended to continue the hydroxychloroquine for your lupus patients during pregnancy, period, full stop. And I don't know any other medication that's like that.
Wait, you got the answer right?
Yeah. So the CDC on their website all through most of COVID, and then they took it down for 2 years, and I think it's back, said it's safe during infancy, breastfeeding, elderly, and pregnancy, right? Yeah. And the American Association of Rheumatology said the same thing.
Yeah, and it was in our board review, and they took it out in a subsequent review that I'm doing now, which is every 4 years they do it, or is it 2 years? Whatever it is, I try to always do it. But now and at the CDC also had up that everybody who came in this country as a refugee from the majority of countries out there had to take ivermectin for a couple of weeks, right?
Correct. Yes, you are
dangerous medicines.
Knowledgeable. It's exactly correct. People coming from the Middle Eastern parts of the world had to take ivermectin coming to this nation. At the same time, the FDA was mocking it as horse paste. It was outrageous lies. So
thankfully, in my career, I'd used both medication. Hydroxychloroquine I'd used for years, and by the handful. But even ivermectin, I used to work at a county hospital, and we would see all kinds of helminths and all kinds of crazy worm infections. And so, ivermectin changed everything. We had the opportunity to use it. We did. It never hurt anything. I took it myself during COVID. I don't think it worked. I was really sick, but it didn't hurt me.
Right. So they took the lie too far where they said that it was not safe. And so then that kind of woke people up. But we're left with this huge problem, right, Dr. Drew, that people don't trust physicians. And I'm sorry, I agree with that. I think most physicians should not be trusted. I think we saw that the physician didn't put the patient's interest first. We saw that a lot. And it is also why I launched Gold Care, which is national telemedicine, where we prioritize the doctor-patient relationship. The doctors are only paid for their time. They're not paid by Big Pharma. There's no other route. It's just really like modern old-fashioned medicine, because it was very upsetting to me. I'm a daughter of a doctor. I'm a doctor for a long time, and I couldn't believe how doctors just abandon their patients. They didn't care.
What is your theory about what happened to us? Is it that we were mostly employees, which was new news to me? I didn't realize that. And there was centralization of decision making, and people were in a hysteria and scared to do anything where they might use their judgment or put the patient care ahead of everything else, like they're supposed to?
Yeah, we're very much on the same page. I think there's a few different things that have coalesced, but the easiest one to explain is in my dad's day, 85% of doctors were small business owners, and their clients, their employer was the patient. So the interest matched. The patient's interest and the doctor's interest matched. Flip to my time in the last 5 years, about 15% of doctors are self-employed. And those, the 85% are answering to their corporate employer. I will tell you, in my case, I was fired and threatened to be fired by the hospitals for speaking out. And California Medical Board and other states sent letters to doctors that you could lose your license if you prescribed hydroxychloroquine. So there are powerful interests that are allied against the doctor-patient relationship. But there's ways around it like that. Gold Care is not the only one. You need to find a doctor and just work with that doctor outside of the insurance model or the government model.
Yeah, I agree. Patients have to take control of their health care. And I want to find every way to do that. I've sort of abandoned my protection of the doctor-patient relationship because it's been so frustrating. You're a little, I spent years as a Medicare provider and insurance, and you can't imagine the struggles. And it just was so pathetic and so awful that I get the feeling now that we just got to empower the patients to take care of their care.
Dr. Drew, we're on exactly the same page. So again, my dad was a doctor. My mom used to do his billing. I know exactly what the fights were with Medicare. I was protected a little from that. As an ER doctor, right? We had administration do it. But I know, you really can't win against the behemoth of legacy healthcare. We do these, we do monthly town halls where we just educate people because we want people to have the truth. So next month we're doing measles. We do all talks on, what is the truth on repurposed medicines and cancer care. The truth about vaccines. This is what we bring. We had a town hall on Ozempic, the pros, the cons, and informed consent, bird flu, same thing. So we just want to empower people. I'm happy if people need doctors less often, quite frankly. I think we've medicalized a lot of things that maybe shouldn't be medicalized. Maybe you need a counselor.
Yep, I agree.
Or just a advisor. Yeah.
Yep, completely agree. And or just educate yourself. And, these are things that people understand now. They can make good decisions, and then we are a supportive care. But I want to go back to my original question, though, which is, I was listening to French radio this morning, which I do all the time, and they were replaying clips of the progression of what happened in France. From masks they had the same exact progression. Masks don't work, or if they do work, only the N95s. And now everybody's out. No, not outdoors. Yes, outdoors. They just rolled down the hill just like we did. And I thought, wow, how did the whole world do that? How is that possible? And was it organized in some way? Is there some? You said there's been a totalitarianism at foot here. How did it get over there?
No. I can answer you a little bit more detailed. There's a whole one chapter in my book goes over kind of the public health politics of this that permitted all of this to sweep the world at the same time. There were huge financial interests. I'm going to share a tidbit with you, Dr. Drew. It's going to blow your mind. Everybody thought that the hatred on hydroxychloroquine was when Trump endorsed it. I think it was March 17, 2020. But here's something that's going to blow your mind. Hydroxychloroquine is over the counter in a lot of the world, in the third world, and also in nations where people travel to Africa, for example, to go on holiday. One of those nations is France. And I learned this from Dr. Didier Raoult's staff. So France quietly pulls hydroxychloroquine's over-the-counter status, not March 17th, March 18th, when it blew up. They actually pulled their status of hydroxychloroquine being over-the-counter 2 months earlier, January 13th. In other words, it was kind of planned to attack hydroxychloroquine because, as you know, the shots could not be rolled out quickly if there was an alternative treatment. So if we had to eliminate the possibility, but that's very damning, that piece of information. France knew, and it was kind of planned, like the hatred. So yeah, there was a plan, and we have the receipts. Some of them are in the book.
So Do you maintain I get so discouraged when I think about this time. I don't like thinking about it. And now you've added a new wrinkle to it, which is that there's this infrastructure in place that I was kind of hoping had been defanged at least. But you're saying it's still there.
They're both there. There is an infrastructure there, which is really why I wrote the book, so you can see it. However, I'm actually kind of optimistic because I really think the American people are special. Our Constitution is superlative and special and extraordinary, and we have these rights on paper. So it really is up to us to enforce them. We have to start teaching the Constitution. When I was arrested for J6, you wouldn't know this, but what was used as evidence against J6ers was if they had a pocket constitution on their person. There were a lot of people that were there that were deep believers in the Constitution. They were carrying pocket constitutions. That was later submitted in evidence against them. 50 years ago, children would memorize the Constitution, and that would be something that they learned in government schools. So we can get back to that, right? We can get back to teaching the Constitution, honoring the Constitution, bringing it back to the family, the rights to the parents, not to the government. So I'm actually kind of optimistic about American ingenuity and American family structure. So I hear your pessimism, but I think we have reason to be optimistic, cautiously optimistic.
I'm a biased towards optimism. I have an optimistic bias, but I'm so beaten down by this topic, and then thinking about what happened to you and thinking about the massive out of control infrastructure. It's really kind of astonishing that this happens to us, both our profession and to this government. Now, one of the things that happened to me during the course of all this is I became a free speech absolutist because we must all defend that right. That's the fundamental right that's going to keep us from going all the way into some God knows what. But there are people want to throw out the First Amendment. What is that all? I can't, it's bewildering to me. Do you understand what that's all about?
I've actually known that this has been a struggle for probably 20 years. The correct legal name of America's Frontline Doctors is actually the Free Speech Foundation. We are DBA as America's Frontline Doctors. It is all about free speech. It is all about silencing us. It is the entire game. It is the entire issue. The game changed when Elon Musk bought Twitter, right? So it is all about free speech, which is why I'm telling people that the free speech starts with you not allowing yourself to become censored. It is true that there's a heavy price to pay when people come after you, or even your mother-in-law comes after you for saying your opinion, but you must not self-censor. You must continue to speak. People have a right to hear what you say, but you have a right not to be silenced. We have a human need to do that. So I am pessimistic when I looked at what happened to both of my professions, law and medicine. It's shameful, but I have faith in the American people and the ordinary American, and free speech is the name of the game. It's everything. I
like that. That does make me feel better. But when being a physician for 4 decades, I early on we thought we were doing was so important, and to see our peers send people home and tell them just come back when you're blue, that to me was the most mind-blowing. My mind is blown. So it's also mind-blowing to me to think about people wanting to condemn or alter the First Amendment. Is that something that I can't believe that our peers did that. So I worry that, oh my God, could they change the First Amendment? Could somebody come in here and do that? Is that possible?
I'm going to ask you as a lawyer, it's really not possible. You need 2/3 of Congress to make a constitutional amendment. It's not going anywhere. The problem is when people don't enforce it. So I fight hard to enforce the First Amendment, and I'll give you a specific example because everyone needs to fight tyranny in their own lives. The California Medical Board attempted to take my California medical license based on free speech, literally based on free speech. They sent me a letter in late 21 saying there were public comments that I made about hydroxychloroquine and ivermectin, and I should lose my medical license. I said, I moved to Florida. I didn't even need my California license, but I took a stand, put my foot down. I said, absolutely not. And I fought them for 2 years. And then I fought them for another year on appeal, and I definitively won. And the California Medical Board has had to retreat on going after doctors' free speech. This is exactly how you keep the First Amendment alive, is you have people who say no. And I encourage people to donate to various nonprofits that touch their heart. It's not going to be done by somebody else. If you're not doing the work, then there's a nonprofit out there doing the work. America's Frontline Doctors happens to be one of them doing the work in the free speech for physicians. It's one of our linchpin issues. We fight for doctors whose license are being threatened over speech. And so that's how you win. It's the hard work, the grinding at it. It took me 3 years, but we made a precedent in California that is going to make it incredibly difficult for them to do this again. I hope that encourages you.
It does encourage me. And I'm just thinking back to first of all, I'm just Greg Lukianoff. What's the Greg Lukianoff's organization called? Caleb, help me with that. Fire. It's called Fire. They're assessing free speech on campuses.
Fire.org.
Fire.org, exactly. But it's interesting. You're reminding me that back in 1983, I started doing radio because I thought it was important to talk to young people about this thing we were just starting to call AIDS. We did not yet have a causative agent, but we were getting into focus how it was being transmitted. And I just thought, we got to talk to people. I had this opportunity. I came out and said, let's talk to young people about this. I was vilified by my residency director and was threatened with all kinds of things. Actually stopped for a while. And then there was a sea change where after about 6 months, the mandate became doctors must talk about this. Doctors must go out and reach out and educate young people, everybody about this. And and I remember my father saying to me, they're infringing on your free speech. This is a civil rights problem here. And I was like, yeah, but I could still lose my job. I'm an intern, I'm a first year resident and stuff. And so it is just, this has been going on for a little while, I guess. And we have to, thank God I did keep going.
There's a few things. So the First Amendment is strong and you have to just fight for it when it's being infringed upon. There's also, it's illegal to do viewpoint discrimination. So we're, AFLDS, the Frontline Doctors, has just submitted an amicus brief on viewpoint discrimination because the state of Colorado has blocked counselors from explaining biological truth to children with gender questions. They've actually said you can't talk about biological truth. You can talk about the dysphoria, but you cannot talk about biological truth. I think they're slam dunk going to lose that. That's going up to the Supreme Court in a few months. So that's Chili's versus Salazar. I don't see there being any way, but you need strong advocates to fight these fights. So we're going to hang on to our First Amendment, and there's people like me who are super passionate about it. So I just encourage everybody to join the fight if you can't fight yourself.
It seems daunting if you're not when you're not, you don't understand the legal system, you're not a lawyer, it looks expensive, it looks time consuming, it looks overwhelming. I'm so grateful you're doing this, but and my son is a lawyer, and he pointed out the same thing. He goes, yeah, the courts this is something the courts can do. This is the courts are good for something, and this could be it. The other thing is be aware of what mass hysteria is, what a mass formation is. Interestingly, I used to bring this up during the mass formation, was that Alexis de Tocqueville, who came here in 1820, pointed out, he's a Frenchman who came allegedly to look at our penitentiary system, but ended up talking about democracy in America. And one of the things he pointed out was that we had the most significant privilege of free speech prescribed by the law, but in practice, it wasn't so free. And he called it the effect of the town square. And now with social media being the town square, I mean, it's that much more breathtaking that Elon Musk came in and freed the town square, which is the one major impediment on our prescribed rights.
I think an easy fix, and I don't know if it'll happen in the next 4 years, I think there needs to be a virtual Bill of Rights, that your Bill of Rights continues into the online space. I think it's kind of a quick way to make sure that we don't lose our free speech rights ever again, no matter who runs the social media companies, right? Why should our Bill of Rights...
And then I hear you, but what do we do with the EU, who seems intent upon restricting that privilege?
The answer is financial pressure. So everybody eventually comes around to the side that can pay the money. So when we live happier, healthier, wealthier, better lives, they will fold.
Simone, I am so glad you're doing this work, and I'm so glad you're here. It's Dr. Simone Gold, X, Telegram, Truth, Getter, the Gold Report on Substack. Anywhere else you'd like people to go? Obviously, go get the book, The Selective Persecution, and look for the movie and the documentary when it comes out, because this kind of stuff, somebody's got to do a real serious visual dive on all this, because the history needs to be documented. It's very important.
Absolutely. I hope people please pre-order. It's a fascinating book. It's a page turner, Selective Persecution, on Amazon. And it was a pleasure to be here and chat with you, Dr. Drew.
When is it out? When does it come out?
It's out in May.
May.
But everybody pre-order that. It really helps. I'd love to come back.
Pre-order it now, but I'm ruminating on maybe getting you back in here once people respond to it and give them a chance to react to what you put down. So, okay, Dr. Gold, thank you so much for being here. We'll hopefully talk to you again soon.
Thank you so much, sir.